All right, so we're about to talk about a lot of cervical issues. All right, and when we're talking about cervical on this channel, don't mistake the cervical of the neck bones to the cervical referring to cervix. So here we'll talk about the annular cervical detachment, which of course, we're talking about the cervix. So for the annular cervical detachment of the cervix, it's just a rare but it's a serious obstetric complication. So it involves complete or partial separation of the cervix in a circular, that's an annular fashion. So there's a separation of the cervix. So it typically occurs during labor or delivery and can be associated with both vaginal birth and cesarean sections. Okay, so what is it? It's a total or partial circular separation of the anterior or the posterior lip of the cervix, sometimes resulting in a complete amputation. That's like complete detachment of the cervix. So types, you can have the complete one and you can also have the partial one. Okay, so causes and risk factors: prolonged labor. So if the labor has been too much, push has been too much, all right, cervical dystocia. All right, then bearing down on an undilated cervix, that's premature pushing. All right, repeated vaginal examinations can weaken cervical tissues, but that shouldn't be actually the main issue there. Strong uterine contractions, obstructed labor. Therefore, clinical presentation: cervix may protrude through vaginal opening, detached tissues. Okay, that's maybe visible. That's a clinical presentation. It's often accompanied by fetal distress. May occur during cesarean sections. Okay, so that's like during cesarean section. If there's like failed fetal extraction, you actually have this one coming in. Okay, so for what we have next, then obstructed labor. So pressure and trauma to the cervix can also cause all of these issues. Okay, no, I've already passed this place, right? So we're about to actually go to management. So management, of course, if a cervix is detached like this, I want to actually do surgeries, to fix it back, then postnatal care, then counseling. All right, just tell the mother about issues around this thing. Okay, so that's E for annular cervical detachment.